if you can tell me what color the chain on my glasses is here.
Gold.
And then lastly, in any empty space here, I'd like you to draw a small triangle, and then a circle around the triangle, and then a square around the circle.
Yellow. Green. R. Z.
Good. Okay. So I'm going to have you follow the light just with your eyes. Don't move your head, okay? And close your eyes for me.
Different. 2, 1, 1. Stay the same.
Clear.
Yes.
Go ahead and relax. All right, Brittany, welcome back to the office. I have you in for a follow-up. So we're going to be doing your cranial nerve exam, and then I have you in for that extended cognitive assessment. So last year when we performed this examination, there were a couple things that you had that were considered defective, abnormal, specifically with the memory questions, and then I think you had a couple issues with your sensory examination. So I will go over those notes, but we are just going to go ahead and re-perform a lot of that today. So we're going to start with the basic neurological exam. I'll ask you the same questions we did last time, the stroke questions. I'll have you write a couple things down for me. I have a couple tactile things that I'll have you play around with. And then we will switch over to a bit more of a clinical assessment where I'll do kind of a lighted eye exam, test some of your senses, and then we'll test your sensory function as well, since you did have issues with that previously. Okay. Now before we get started, is there anything specific that you're concerned about today? Have you noticed a decline in your cognitive function? Any changes since your last exam?
No.
Okay. All right. So let's go ahead and get started here. Excuse me while I get my glasses on. All right. So if I could just have you confirm your name for me.
Brittany.
Good. Just gonna confirm a couple pieces of demographic information here. Does your mailing address remain the same?
Yes.
And you have a phone number that ends in 7896? Okay. Same emergency contact as last year. Phone number and everything for them hasn't changed.
Yes.
Alright. Your phone number, so we can confirm that, still the same. I did see that there was a change in email, but it looks like we got your updated email. Alright, so we're going to go over a couple questions about your current health history. So just answer to the best of your ability. Obviously, honesty is the best policy here. So if you could tell me right now how you're feeling, just on a general basis. Generally well, unwell?
Generally well.
Good. Are you experiencing any pain?
No.
So on a scale of 1 to 10, 1 being little to no pain, would you say you're at about a 1?
Yes.
Now you do have a history of migraines. I did note that last year, and I also see that noted here that it's still current. So when is the last time you had an active migraine?
About a week ago, actually.
A week ago? Okay. And was that the same kind of caffeine induced or lack of caffeine? Okay. Do you remember prior to a week ago when your last migraine was before that?
It was at least 3 or 4 months.
Oh, okay, so quite a while,
Yeah.
quite a gap in between there. Okay, so that is a significant improvement from your last visit. We had you averaging about every 2 weeks.
Mm-hmm.
So we have made some strides there. Have you, I know we recommended that you cut back on the caffeine a little bit.
Mm-hmm.
Have you made improvements there?
Yes. I stopped drinking it before noon.
Okay,
Mm-hmm.
good. All right. And what about your sleep schedule? How are you sleeping?
Pretty good.
Pretty good? Okay.
Yeah, that's improved.
Good. So about how many hours of sleep are you getting, would you say?
Probably about 7.
Good. Very good. Okay, so that's up from 5.5, 6 from the last time. So that is very good. Good improvement there. Okay. Right. Now we have that you were fairly physically active, about 4 to 5 days a week working out last time. Is that still pretty accurate?
Yes.
Very good. Okay. Any dietary changes?
No.
Right. Okay. When was your last physical assessment? Just regular annual checkup with your PCP?
Pretty recently.
Was there anything going on there?
No.
Okay. Very good. All right. Can you tell me what you ate for breakfast today?
I had oatmeal.
All right. Do you remember what you had for breakfast yesterday?
Oatmeal.
At least we're consistent. All right. Okay. So throughout the examination, I might randomly ask you to identify an object for me, either its appearance or just descriptive words. So if you can tell me what color the chain on my glasses is here.
Gold.
Can you tell me what day of the week it is?
Thursday.
Very good. What month are we in currently?
September.
Very good. Can you tell me what year it was 5 years ago?
2020.
Tell me anything relevant that was happening that year.
COVID.
Okay. Can you tell me the last thing you watched on TV or on your phone?
I watched. What did I watch yesterday? Sorry, I'm
No,
blanking.
that's okay.
I watched. It was a movie with Tom Hanks in it.
Okay.
I think it was like a war movie.
Okay. That's okay.
It was just on.
Okay. I'm gonna have you repeat a series of 3 words for me. Light, window, table.
Light, window, table.
So we will come back to those, so just try to keep that in mind for me. Okay. So I am going to move on to a couple cognitive tests here, very basic verbal tests. So I'm going to ask you a couple questions. Let's start with a couple math equations. Nothing very elementary, so just nothing to worry about here, just very basic. If I could have you add 3 plus 3 for me.
6.
Good. And 6 minus 3.
3.
Good. And 3 minus 3.
0.
Good. Do you remember the first set of equation that I asked you?
3 plus 3.
Very good. Okay. I'm going to ask you a basic scenario here. If I give you 10 apples, so you're physically holding 10 apples, I then ask you to give back 5 apples. How many do you have remaining?
5.
Good. If I now give you 3 apples, how many do you have?
8.
Good. And if you drop 4 apples on the floor, how many are remaining in your hands?
4.
Good. All right. Do you remember those 3 words that I asked you earlier?
Light, table, window.
Very good. Good job. Okay. Okay. So, if you could tell me, let's see, function, short-term memories intact. Do you remember the name of one of your elementary school teachers? Could be any subject.
Mrs. Johnson.
Mrs. Johnson. What subject did she teach you?
Social studies.
Very good. So just testing your long-term memory. Good. Okay. I am going to have you take my pen here and hold the clipboard for me. I'd like you to write your name here where it says patient's name. Good. You could fill out today's date. Good. And then lastly, in any empty space here, I'd like you to draw a small triangle and then a circle around the triangle and then a square around the circle. Good. And if you can draw a very small 3D cube for me. Good. Perfect. Okay. Just testing your ability to write legibly, dexterity, and basic shapes. Very good there. Okay. Alright, Brittany, so we're going to move on to a different part of your cognitive function here. Now, this is a stroke scale. I know you're familiar with this as we've looked at it before. So, I do have a different scenario for you this time. So, can you identify how many people are in this picture?
3.
Good. And if you can tell me one thing that looks abnormal to you here.
The water overflowing in the sink.
Very good. And can you tell me what this person appears to be doing?
Taking cookies out of the jar.
Good. And what danger does he seem to be in at this time?
He is standing on a stool that's about to tip over.
Very good. And as far as the water here, what do you think we could do to mitigate this situation?
Turn the faucet off.
Very good. Okay. Alright, let's come to this side first. So I have several different very basic objects here. I'd like you to tell me which one of these would be considered a garment that you would wear.
The glove.
Good. And can you point to something that you would find outside?
The cactus.
Good. And is there anything here that you would be able to lie on?
The hammock.
Good. Okay. A couple of very basic phrases here. If I can have you read this for me.
Tip top. 50-50. Huckleberry.
Here.
Player. Baseball. Mama.
Alright. I can have you read this sentence here.
They heard him speak on the radio last night.
Good. And here.
You know how.
And here.
Down to earth.
Alright. Ability to read and identify basic situational awareness is intact. Check off a few things here. Good. Okay. Now, point to a couple letters here. I want you to just try to identify them for me. So let's start with the very top letter.
E.
In here.
L. T. F. P. H.
Good. And if we jump down here.
E. P. T. Z. O.
Good. Are you able to read this line at all?
LTFPH.
Good. Can you tell me what color this is?
Red.
And here?
Green.
Can you tell me if this or this is smaller? So here or here?
2.
Good. Okay. So now I am going to have you occlude an eye. So I'm going to start with this open, and you're just going to cover one eye just like this. Good. And if we can read this middle line here.
OLCF.
And again, can you read the smallest line?
LTFPH.
And what color is this?
Green.
Can you see this here?
Yes.
Is this larger or smaller than this here?
Larger.
Good. I can have you switch eyes for me. You can read this line here.
LT.
And this line backwards.
OZTPE.
Can you read the smallest line?
LTFPH.
And what color is this?
Red.
And would you say this and this are the same size?
No.
Good. Is this one larger or smaller?
Larger.
Very good. Okay. Thank you very much. Any changes in your visual acuity recently? Have you noticed any issues with seeing either at home or while you're watching TV or you're driving?
No.
I don't have that you have a history of prescription glasses or anything.
No.
Good. All right. Okay. That is good. A little bit later on, I'm going to do the regular lighted eye test and that kind of stuff. So just getting the brain stuff out of the way for now. Okay. All right, so a couple tests for color deficiency here. Now I know these should be familiar to you. Do you see a number here?
Yes.
In here?
Yes.
Now I'd like you to identify the number.
7:45.
Perfect. In here.
2. There's no number.
Very good. In here.
16.
Anything in here?
There's no number.
Do you see any pattern or?
There's a little pattern.
Good. So I'll have you take this for me. You can trace that from start to finish. Perfect. Very good. Color perception appears to be intact. We will test that a little bit further shortly. So let's go and check those out. Acuity, 2020. Just a color deficiency. Okay. So I've got a couple objects here. Let's go ahead and start with these here. So I'm going to have you identify the color of the object.
Orange. Blue.
Good.
Green.
Good. Are these the same color?
No.
Are these the same color?
No.
Are these the same color?
Yes.
Are these the same color?
No.
Good. Are these the same color? Are these the same color?
Yes.
Good. Identify some colors here. So can you tell me what color this is?
Pink. Yellow. Green. Blue. Green. Yellow. Pink.
Good. Are these two the same color?
No.
Are these two the same color?
No.
Are these two the same color?
Yes.
Yes. And silver and different.
Yes.
Very good. Can you tell me what color this is?
Yellow. Gray.
Good. So we will come back to these and use this for a secondary test here in just a second. Now, I'm going to move on to asking you to identify a few objects for me. So before I open this, if I could have you close your eyes for me, I'm going to have you hold your palms out. I am going to place an object in your hand, and I would like you to attempt to identify the object. So start with that one.
A carabiner.
Very good. And this here.
A puzzle piece.
Very good. And here.
A safety pin.
Perfect. And here.
A thumb cover.
Okay, good. It's a rubber thimble. I will take thumb cover.
Yeah, thimble.
And this object here, I'm going to hand to you. Identify that for me.
Another carabiner.
Good. And how is that one different from this one here?
This one is smaller. This one's larger.
Very good. So if I can have you open your eyes and peek at those for me. Are they the same color?
Yes.
And what color are they?
Orange.
Very good. Okay. Good job with identification of objects. Now, I have these 3 puzzle pieces here. They do fit together. I would like you to attempt to fit them together for me. Very good. Good job. Puzzle we time about 20 seconds is average, so you did very well there. Good job. So I am going to test for another neurological reaction here. So a couple different tactile sensation I'm going to place in your hand on your hand, and I want you to firstly just kind of look away for me. So keep your eyes open and just look away for me. Okay. Now I want you to close your eyes. I am going to write something in your hand, not actually, but just make the motion of writing. I'd like you to try to identify it. We're starting with a number, okay? I apologize, that was a letter.
Was it A?
It was an A, thank you.
B? T?
Good.
V?
And this side.
W?
Good.
Z.
Good. And a number.
10.
Good. And here.
8.
Perfect. Okay. All right. So for the first part of our neurological examination, everything is okay. I didn't notice any deficiencies. There were actually a couple things that you were able to get correct this time that you did not last time. So there is a noticeable improvement there. Okay. So we are going to go ahead and move on to more of the clinical side of things. I'm going to wash my hands, put on a pair of gloves. We'll do the check of your eyes, the lighted test. Mostly want to check your pupillary reflexes, that kind of thing. I also want to check your ocular reflexes as well. And then we will do a bit of a sensory examination on the face, specifically where you had the deficits last time. Okay? All right. So give me just a second to reset here. All right. So we are going to go ahead and get started with the secondary portion of the examination. You doing okay so far?
Yes.
All right. So let's begin by testing those pupillary reflexes. So I'm going to use my Penlight here, and I'm just going to bring it in. Slightly concerning about the migraine. I don't want to induce a migraine, so if you start to feel any pressure behind the eyes, definitely let me know and you can draw back the light. Okay, good. Now I'm going to have you follow the light just with your eyes. Don't move your head, okay? Any double vision here?
No.
Have a look at my finger here. Good, and look at my finger here. My finger here. Now look at the light. Look at my finger. Look at my finger. Look at the light. And look at the light. Good. Okay. Pupillary accommodation is intact. Let's go ahead and test for more pupillary reflexes. So I'm going to use a cotton tip here, just sort of like a Q-tip. Pardon the ambulance. We're not far from the ED here. I am going to just make sure we're not obstructed here. Okay. So I'm going to bring this very, very close to your eye. Just kind of keep your eyes open lazily. Allow yourself to blink as needed. Fantastic. This time just a little more reactive. Any tingling sensation, any like pins and needles or static?
No.
And close your eyes for me. Good. Keep open. Since slightly uncomfortable, I'm going to blow a puff of air in your eyes. Okay? Okay. Give your eyes just a little bit of a break. I know it's kind of intense there. I'm just going to do a couple of tests of your visual field as well as your peripheral vision. So coming back to these objects here, if you could identify the color for me once again.
Yellow.
In here.
Great.
I'm going to call out a color. I'd like you to focus on that color. Great. Yellow. Great. Yellow. Great. So kind of accommodation there. This time I'm going to test with a moving object. So you can identify this color for me.
Blue.
So I'm going to move this around, testing your periphery. I'd like you to keep your head very still for me, okay? So we're following with just our eyes. You're going to tell me when you can no longer see it and when it reappears into your visual field. So for example, here you should not be able to see this. You should be able to see it about here. Okay? See this here?
Yes.
So tell me when it disappears.
Disappear.
And when it comes back.
It was back.
Good. And disappears.
Disappears. Back.
Let's just see it here.
No, I can't.
Good.
Reappear.
Just switching colors here.
It's gone. Reappear. I can't see it. Reappear. Disappear. Reappear.
What's in here?
I can see it. Disappear. Reappear. Disappear. Reappear.
That appears to be intact. Any blurriness of the vision as we went along with that test?
No.
I ask you to identify a couple objects for me based on their type and likeness. So, can you tell me if these are similar, exact, or different?
They are exact.
Good. These are similar, exact, or different?
Different.
Okay. Similar, exact, or different?
Similar.
And lastly, similar, exact, or different?
Similar.
Just testing your brain's ability to tell like-minded objects from objects that are completely unrelated. So perfect good there. Testing your pattern awareness. Test your hearing function just very, very briefly. So quick clicking noise, I want you to just identify if you can hear it. Okay? So try this for me.
I can hear that. Yes.
Okay. I include this side.
Yes. Yes.
Okay. All right, Brittany, so go ahead and open your eyes for just a second. So I'm going to use these two identical objects. going to touch either sides of your face at the same exact time. I will have you close your eyes just so you can focus on the tactile sensation, but I really am identifying your ability to tell me if the pressure is the same or different. Okay.
It's the same. Different. 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 Same. Different. Same. Same. Different. Same.
This one is going to be a little bit difficult. I'm going to touch you with 2 different objects. They feel very similar with your eyes closed. So with your eyes open, this is going to be 1, and this is going to be 2.
Okay.
Can you tell the difference?
A little bit. With my eyes open.
Okay. So we'll try with your eyes closed, and if you can't identify, then we will pivot. Okay. So I'm going to start again in your hand. Is this 1 or 2?
1,
1 or 2?
2,
1 or 2?
2,
1 or 2?
2, 1,
Good. So I'm going to try on your face here. Is this 1 or 2?
2, 2, 2, 2, 1, 1, 2, 2, 1, 1, 2, 1, 2, 1, 2, 2, 2, 1, 1, 1, 2, 1, 1.
Keep your eyes closed for me. I'm going to grab a different set of objects here. Let's try this instead. This is going to be 1. This is going to be 2. Can you tell the difference?
1, 2, 2, 2, 1, 1, 2, 2, 2, 1, 1, 2, 2, 1, 2, 2, 2, 1, 2, 2.
Go ahead and open your eyes for me. So there were a couple discrepancies there, which is in line with where you tested at the last time. So you do have trouble telling between objects that are similar but not exact when your eyes are closed. So I would say your tactile sensation is still just slightly delayed in response. You are able to feel both objects. Maybe about 50 or 60% of the time you do get them correct, but there is that 40-50% where you do get them incorrect. Okay? Particularly on the forehead region there. Almost done here, Brittany. I'm going to test just a few more things and then we'll complete our examination today. So let's go ahead and do hold response. Now this is going to test your bilateral sensation response. So they're very identical objects, same temperature. Can you tell that they're cold?
Yes.
Okay. So I'm just going to move your hair here slightly. I'm going to touch you with both objects in identical places. I want you to tell me if the temperature feels any different.
Okay. Same. See. 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 Different.
I'm going to run a cold object down your arm. I want you to tell me if the temperature changes anywhere.
Stay the same. Stay the same. Yes. Yes.
Same here.
Yes.
Any difference here?
No.
Alright. Go ahead and open your eyes for me, Brittany. I'm going to have you just kind of look forward for me. You see your palm, please. Other side. Go ahead and relax. Okay. So I would say that is going to conclude this year's follow-up examination. Now, for the initial part of your neurological exam, so the verbal portion as well as the written portion, you did very well. I did see some significant improvement from your last visit, which is very good news. Now, the tactile portion of your examination was still slightly questionable. There were a few things that I would say were teetering towards not passable, but you did still get over the 50% mark. So I do see some improvement, maybe like a 5 to 7% improvement from the last time we tested, but there is still quite a bit of deficit there around the forehead, a little bit here around the left side of the mouth as well. Okay. So certain quadrants of your face are still showing some deficit in tactile sensation. Now the good news is you're able to tell the difference between like cold and warm, for example, sharp and dull. So it's not like you're just completely lacking in sensation. It's when this sensation is very similar, you just have a little bit trouble with distinction. Okay. So I will suggest that we retest again in about a year's time. Don't see a need for you to come in for a 6-month appointment. So that is good news. I will go ahead and input all of this into your chart, as always, so that your primary care has access to it should they need it. Is there any questions you have for me today?
No.
All right. That is going to conclude our examination. I will give you back your sweater.
Thank you.
And I hope you get home safely.
Thank you so much.